This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosting an array of events from Civil War reenactments to diesel truck pulls. More information online at virginiarodeo.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a very special welcome to Secretary Bill Hazel.
Thank
William
you, David.
A. Hazel Jr., but certainly the folks that know you from your orthopedic practice in Northern Virginia and your friends, and those of us that have had the privilege of knowing you since 2010,
Yeah, been a while.
as you began serving, that it's Dr. Bill, Secretary Bill Hazel. So
Make the kids call me Dr. Secretary.
Dr. Secretary, that's good, that's good. Well, we're having this conversation, we'll let our viewers know, on Friday before the special session convenes.
I don't know that there'll be any special concessions if that was
right.
Freudian, but
That was a good Freudian slip, so maybe there will be something that comes out between the two chambers that will work out on this. But we really wanted our viewers to have a chance to hear and to see the presentation that you've been making around the Commonwealth if they haven't gotten in on one of those. And so we've pulled some slides from that are available from some of your presentations, and we're going to have those on the screen and have you speak to them to help the viewers understand what Medicaid expansion or Marketplace Virginia, however you look at it, what it means and what it could mean to thousands of Virginians.
very good, very good.
So we'll just start right away with the first of those slides, and as they come up on the screen, we'll ask you just to speak to them and let the viewers know what they're seeing.
Okay, well, surprise me with the first one.
Okay.
Okay, well, I think this really hits to the heart of it. With the PPACA, there was an effort to ensure that more people had access to health care through coverage. And this was done through several ways. One of the ways was creating the federal marketplaces or the state marketplaces. In Virginia, we have a federal marketplace which is available for people with incomes above 100% of the federal poverty level. The challenge is when the Supreme Court ruled that the Medicaid expansion was optional, that meant people that were below 138% of the federal poverty level, who either would not be eligible for the exchange, or if you're in that 100 to 138, may not be able to afford it anyway, would not have access to Medicaid unless the state itself elected to expand the program, to find a way to cover these individuals. So this discussion is about what happens to these 400 or 1,000 or so individuals who are not covered by Medicaid and who will not, for one reason or the other, be able to be insured through the exchange. And the bill set up a series of taxes and fees which the Congressional Budget Office in 2012 said would be $26 to $27 billion from the pockets of Virginians that go to the federal government that were intended to come back to pay for this coverage. So every day as the slide points out, we leave about $5 million collectively on the table.
Well, we have another slide too that shows where the uninsured are, which I think is interesting to see that slide.
Yes.
You might explain to the viewers what the different colors mean, because they may not see the code.
David, the redder areas, and it's I think what you would expect along the southern border of Virginia and out into southwest are areas that have a high percentage of individuals who are uninsured. and then, though, if you look into that little inset up in the upper right-hand corner, you can see that in northern Virginia, there still are a lot of uninsured. The percentages of the population are smaller as the counties are wealthier, but there are so many people that, surprisingly to some, there still are a large number of uninsured in even the relatively prosperous northern Virginia regions.
And I think it was showing too when you come into the central Virginia area,
right,
that the color was not quite as red.
Correct.
But still it showed a significant number.
And folks who are uninsured are all through the state, really.
Yeah. And there's another slide that helps describe who these uninsured are, because to hear some of the folks talk who don't really think we should move in this direction, I might think that they're just people who are not working, people who are not doing anything, and this one gives some of the information.
Right. The studies would suggest that of the families that are uninsured, or the adults are uninsured, over 70% of them have someone working at least one job, if not two, or more than one individual working. A large number are white, non-Hispanic individuals. Folks, and when you say, well, who are they, and what do they do? These are people that have limited incomes. When we go out on the road, you'll find folks, for instance, I see a lot of women who may be now divorced, don't have the insurance through their husband's plan anymore. They do not actually make enough money to get into the federal marketplace. But what surprises people is we don't cover single adults or childless adults in Virginia. We've already got the kids. We've already got the age blind and disabled. We've already got individuals with intellectual and developmental disabilities. So the folks who are in the gap are these single folks. They generally are reasonably healthy. They've got some demands because they haven't had medical care for a long time, and in places where people have been uninsured, there are some initial needs, but they turn out to be folks like the rest of us who are going along making their living.
You know, there's another chart slide right after this.
Yes.
That really helps to describe who would be eligible. I think the one on the far left speaks of pregnant women.
Correct. Well, today we cover pregnant women. The challenge we have is that a lot of pregnant women don't actually get into care until their third trimester, when frankly it's late. We have a terribly high infant mortality rate in Virginia for a state with the wealth that we do. I just came from an hour-and-a-half meeting on how we can reduce infant mortality, and getting women into care earlier is part of it. The challenge is that over there on the right side is where we don't cover either single or married women, for that matter, who are childless. And even if you do have a child, the kids may get coverage, but the mother doesn't, above about 20% of the federal poverty level. It's hard to have healthy kids and healthy pregnancies if women are not covered early enough.
You know, I think that another point to get you to reemphasize and make sure people heard it right, that those that are quite poor, are many of them, most of them are covered by Medicaid in Virginia.
Well, the kids are, and the age blind and disabled are, and if they're very poor, parents would fall into that, the caretaker parents. But for the most part, if you are single or married and you're working, but you're in the poverty range, no, you're not getting Medicaid today.
And then if you're in that range that you're more than 133% above federal poverty level,
right,
then you are eligible under the Affordable Care Act to get some subsidized insurance.
Right. Well, what's interesting, we were in Petersburg last week and then in Emporia, and there are these application counselors that work for the federally qualified health centers. And of course, one of the first things that they do is they take the individuals to the federal marketplace and try to sign them up. They're telling us, or 75% of individuals do not qualify for the federal marketplace because they do not make enough money to qualify for the federal marketplace. And then, which is ironic, really.
Yeah, it really, I mean, in a way, it's almost absurd that you can not make enough to do that and make too much to get
Yes.
the other care.
And I think that's the gap. And
It
that's
is.
the gap that we're trying to close in one way or another.
Okay, let's move to the slide that talks about how would Virginia pay for this, and where's the money coming? And I think the top line is showing for the first couple of years it's 100% federal.
Well, you know, David, make no mistake that whether it's federal money or state money, it all comes from the taxpayers.
From Virginia taxpayers.
From Virginia
Yeah.
taxpayers. And what the dirty little secret here, if you will, is that the taxes have already been raised to do this. This is money that Virginians collectively are paying in. Congressional Budget Office is generally deemed to be the authority on such issues, $26 to $27 billion that Virginians will send to the federal treasury between now and 2022. We're actually going back some to 2010 and 22. Now, of that, and by the way, as part of this PPACA, there were cuts to payments to hospitals, which added about $6 billion of money that had been counted on to pay for health care in Virginia. Now, the deal was that we're going to take this and we're going to re-engineer it so that we can get people into care earlier, perhaps do some prevention work when it's less expensive, not wait for them to get to the emergency room where they're really sick and it's too late and the outcomes are poor. So we're going to insure these people. Now, we get about $6 billion back, we think, if the marketplaces work. The marketplace is something different, but this Medicaid piece or the coverage gap or whatever we decide to do will bring back about $2 billion a year to Virginia's healthcare system. About 200,000 of that would go for mental health services, which we need. The other piece is that in the process of doing this, the tax money that we are getting back via Washington would be used to pay for about 95% of the indigent care at UVA and VCU. That saves Virginia taxpayer or the Virginia budget money. So interestingly, the Virginia budget will experience maybe $1.1 billion worth of savings between now and out to 2022.
Okay, I think the next slide really just shows part of what you were just saying about how the money that we're already paying for it without receiving the benefits.
Right.
And so let's go to the.
Let me just
yeah,
say,
okay,
that some raise the legitimate concern that, well, the federal government is challenged financially. And what we know, and in fact, I got a letter last night from Cindy Mann, who runs the Center for Medicare and Medicaid Services, that reiterated that it's Virginia's option. If the money that the feds have promised stops or goes below a certain point, Virginia can stop at any time. And our argument, quite frankly, is early on, while President Obama's there, that money's not likely to go away. Let's take advantage of this, several billions of dollars coming into the system, several $100 million worth of savings to the Virginia budget, and let's program some things in that would improve the value of the health system for all Virginians.
And I think that's, what I understand, has been part of the plan that the Senate worked on. That's
right.
That if the money stopped, then what they are calling Marketplace Virginia stops.
Right. That it would stop.
Yeah.
It would be automatic, and that's what would happen. But even now, some are concerned, well, what happens when the feds go down to 90%, assuming they stop at that? But even with the numbers that we have and what we now know about the population that would get coverage, whatever the mechanism is, even in 2021 or 2022, the incremental cost to the Virginia budget would only be $11 or $12 million a year. 11 in 2021, 12 million in 2022. And I mean, our budget now is going to be $47 billion annually. So you're thinking by 2022 with normal growth, that's a very, very small amount.
Okay. Now, there's also a slide showing that the Affordable Care Act does pay for itself, and I think that you've spoken to that. Anything
Correct.
else on this slide?
No,
that-
I think that is. There's been a lot of talk back and forth about whether it's expensive and affordable, but the long and short of it is there were 21 separate revenues, fees, whatever. When you move money from individuals to somebody who didn't plan to part with the money, those are taxes. Those were raised. That happened 4 years ago in March. In fact, we're coming up on the 4th anniversary of the signing of the 2 bills that became the PPACA. So that money is leaving Virginia now, and it's a one-way ticket unless we decide to take it back.
Okay, let's look at the slide that speaks of the funding source number 1, the reduction to Medicare payments.
Correct. Correct. One of the things that we have been hearing is, well, there's really not any hurry to fix this problem because the hospitals don't get hit for a few years, but in fact they are now, not through Medicaid but through Medicare. And part of the deal was with the hospitals was that the Medicare payments under Medicare would go down some, but they would get the money back through Medicaid. For that to happen, we actually have to close the coverage gap through Medicaid or some other mechanism. That's a $1.5 billion loss for the hospitals from 2014 to 2018, and some significant job losses. We know that there are a number of hospitals in Virginia today that are in the red. We've seen the Lee County Hospital closed, largest employer in Lee County. Been to Tazewell, they're running about a $2 million a year deficit. Even in Fredericksburg, when we went up there, the Mary Washington Hospital Center, and it's bittersweet having to announce this publicly, but they are using their reserves to fund operations, and their debt is more than their reserves already. So even systems that appear to be in good health are struggling. Then with sequestration, there were some additional cuts to hospitals that weren't even foreseen with this. So we have some precarious situations, and why it matters to people with insurance is when that hospital is 5 minutes from you. The gentleman in Tazewell was saying, I live 5 minutes from it. I had a heart attack last November. If it hadn't been there, I probably would be dead today. Mm-hmm. Now, if that hospital closes, he has insurance. That matters to him.
Mm-hmm. You know, you've referenced something that's on the next slide that speaks about the increase in federal taxes, but it may be that some people are paying those and haven't recognized that it's happening. Well, and the federal payroll tax increase that's referenced here, and the others that maybe it's taken just a small bite out of all of us who are earning in Virginia, that we haven't noticed that we're funding this.
I think it's a small amount for a lot of people that's coming out of your payroll taxes. You see the numbers here. But I think really what the areas, Northern Virginia in particular, gets hit because a lot of the money is coming from wealthier individuals.
Yes.
And I will guarantee you that those folks noticed it this year.
They know they're missing 3.8%.
It's going someplace.
Yeah.
And the question is are we going to get it back and use it to meet our own needs in Virginia? And I think that the idea of the federal government can use the $20 billion that Virginia is sending up to close the deficit unilaterally on the backs of Virginians doesn't make a lot of sense.
No.
Governor says, you go get gas, 18.4 cents on every gallon is going to the federal treasury, and not taking the money is like him calling the Secretary of Transportation and says, sir, our roads are just fine. We don't need our money back. Go spend them in New York.
Yes. I'm sure we will rush to do that. The next slide shows some of the outflow of the Virginia dollars, and again, this is just really a graphic way of showing what you've been referenced. It starts with that $5 million every day.
That's correct, and those are real numbers based on what we know from the Congressional Budget Office, and of course that does not include the budget savings that we see in Virginia.
Okay. Now, the next slide speaks of failing to close the coverage gap, and some of the debate that took place during the regular session. Again, reminding the viewers, we're talking on Friday before
That's right.
The special session has convened, and we'll see if there are concessions or not from one side or the other. But about there's no rush in doing this, and if we don't close it, and this slide speaks of this failing to close it, what it means.
Well, there is the economic piece, which we've talked about, but there's the human cost of this too, David, which is what we're seeing. We have a lot of folks who are out there working. Another area that we see is folks who have stopped working to take care of aging parents. I met a gal last week who stopped working to take care of her aunt. Without her taking care of her aunt would be in a nursing home, would likely eventually come into the Medicaid program and on one of our nursing home long-term care waivers. So this woman is taking care of her aunt and keeping her at home. She does not make enough money to get insurance for herself. I mean, these are real stories that we see. Ran into another woman down in Abingdon at a free clinic. Actually, I'll change story. I ran into a guy down there who, prosperous employee, he had some savings. He decided to go back and get a PhD in his 50s from Virginia Tech. Everything crashed in 2008. He lost it all. And he is there as being a student. He has to go to the free clinic for health care. Now he's recovered, he got his PhD, he's now a professor at Virginia Tech. He's on the board of the free clinic in Christiansburg. But this happens to people.
And we have a couple of slides that speak of the systemic effects of the coverage. And the first one kind of gives the overall part showing covering the uninsured. If we go on to the next slide, it really breaks it down, and you've spoken some of mental health. Say something
Correct.
more on that, and then on public safety and education.
Well, yeah, there's no doubt that we, like a lot of states, are struggling with mental health issues, workforce capacity, systemic issues, and the inflow of funds, of the insurance premium that comes back to Virginia, about $1.6 billion of that between now and 2022 would normally be slated for mental health coverage. With the parity requirements in the federal law and the money coming back in, that gives you a sustainable financial base to really improve your mental health system. The other piece of it, it allows us to free up probably in the same period $235 million that we're currently using to be readjusted to further strengthen the system. So we have a lot to do policy-wise, workforce-wise, but knowing that at least a base mental health coverage is in insurance for these folks really does help. And
the public safety part, so that treatment also helps.
Well, we believe that a number of the individuals who are in the state prisons would be eligible for Medicaid if they get medical treatment outside of the prisons. We currently pay for that with 100% general fund dollars. If they become covered, then it's paid for with still our money, but that's come back to us. But even more, a lot of the problems, believe it or not, there are people who get arrested to get treatment. I mean, it happens. A lot of the mental health problems that go untreated end up becoming the property of the taxpayers and the prison system because we aren't getting the mental health treatment, and these folks come in. So doing some things on the prevention and getting coverage to that earlier will help in that area.
We have another slide on highlights that helps kind of summarize the presentation. Appreciate your going over this. When you look at that slide and our viewers look at it, is there something else that jumps out at you that?
Well, I think the first thing is this. We have a law in this land that was signed 4 years ago that we are all subject to. It doesn't appear that it's going anywhere. Every one of us is participating in this law, contributing in a way, or it is up to us whether we will bring the benefits back to Virginia or not.
That's the challenge.
That's the challenge. That is the opportunity. And David, I'm a lifelong Republican. I worked for Governor McDonnell. It was a great honor to work for him. I spent the last 4 years learning this system and working with reforming and making improvements to the Medicaid program. This budget that Governor McDonnell submitted put in $200+ million worth of savings from the reforms that we have made to the system designed to improve it. We have created some of the tools that are necessary to improve the value of health care for all Virginians, but I believe it's not rational and it's probably not fair unless we're able to find a way to get coverage to more people.
Secretary Bill Hazel, that's a good way to sum it up, a good summary. I'll tell our viewers we've offered and speak to folks if they have a contrary view and they'd like to come on, we'll discuss it with them. And as you said at the beginning, my Freudian slip, and I did study Freud years ago, so I'm sure it was a good Freudian slip, that maybe there will be some special concessions in the special session and that this will get worked out and we will provide this health care coverage. So thank you very much for being on.
My pleasure. Thank you for having me.
Thank you.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosting an array of events from Civil War reenactments to diesel truck pulls. More information online at virginiarodeo.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.